It's a spectrum. And it's highly genetic too. So there is a lot of arguments going on that ADHD has some evolutionary benefits. When we were hunter and gatherers, the idea of being novelty seeking, being distractible, but being able to be hyper vigilant, taking in, we're mostly very sensitive to the world. Most people want the familiar. They want the same routine, the thing. They don't want to venture out into the unknown. But when you're hunter-gatherers, after the resources have been depleted, you need to have some people who are willing to go to the unknown territory. Well, it makes sense that we would have a portion of the population that would have these characteristics.
One of the things I've observed with people with high-functioning ADHD, it is a genius gene. I see the creativity and the go-get-itness, and I see it a lot in working with entrepreneurs.
There's always trade-offs. In one area, it could be seen as a disorder or problem, but in another area, it leaves room for this other capacity that actually might be a superpower or a gift.
I'm excited to have my friend, Dr. Michael Mantz, join us. He is a board-certified psychiatrist and has a master's in herbalism, which has got me super stoked about working with him. I've referred some clients to him that were, ones that I thought needed a little bit more mastery. And so I wanted to invite Dr. Mantz to come have a conversation with me tonight.
Awesome.
Yeah.
I'm so excited.
I know.
Such a beautiful set, too.
Thank you. So do you remember one of the first coffees that we had? Kind of funny to me because we're sitting there talking. I think it's one of those things that a lot of people probably are afraid of, when they find out what we do for a living, that you're a psychiatrist, I'm a psychotherapist.
Yep.
That they're like, what are you going to see in me?
Yep.
Right?
Exactly.
And I wasn't afraid, but at some point, I think it might have been our second coffee, you were like, oh, because you have ADHD. And I was like, what? You know that? Because I had self-diagnosed 8 or 9 years ago, shortly after becoming a clinician. And a lot of that for me was just watching a lot of my higher functioning ADHD clients that had ADHD, I should say, and realizing that they didn't realize they had it, but I was able to diagnose it just by some of their behaviors. But it was really hard to diagnose because it's not what a lot of people think about or hear. But as I was observing them, I started going, wait a minute, I think I have it. And I had many clinicians in several years of doing my own therapy, and not one clinician had ever diagnosed me with ADHD.
Yeah.
And then, but when I started going back and realizing, some of the things I would do when I was like a teenager, go over to my dad's house, his wife, she'd recognized patterns where I'd come in and I'd set my phone here and set my keys there and set my wallet over here, to where she was waiting at the door, here are all your items that you've left around the house, right? And if somebody had thought more about what could this be, that I could have been diagnosed at a much earlier age.
Yeah.
But what was super important for me about this conversation is because there are a lot of information, a lot of podcasts out there about ADHD, but where I really see it, which is sort of my own experience, and I think it'd be interesting to share about what you observed and what your own experience is with high-functioning ADHD, because we hear some of the scariest cases or difficult cases, from school, with kids, and how hard it is for them. But I haven't had that experience with it.
Well, I wonder when you found out for yourself, because I myself had a similar path where you would think, you're being trained in, psychology, and I'm being trained in psychiatry and psychology, and then you would think we would actually be able to know. And then all the time but it's always that rule, if it's so close that you're just blinded to your own self. And then, I often, because myself, I self-diagnosed in my 40s, so having gone through that whole scenario. So yeah, with the whole ADHD and coming around to it, it can be super helpful, because once you start to understand what ADHD is about, and that's actually a hard thing to do, because it's not a clear, clean concept, and I think people are still arguing about it a lot right now, but it could be a very helpful tool to know what the basic essentials are, and I think hopefully we'll be exploring that today, and how, for instance, one thing that we know about ADHD is not related to IQ. So it's not related to IQ. There are people who are low IQ with ADHD. There are people high IQ with ADHD. People even like Leonardo da Vinci are thought to have had ADHD. So it's the whole spectrum. But this high functioning ADHD, which we're kind of focusing on today, is a very interesting group, because I think also in some ways we could put ourselves in that equation ourselves. And with that knowledge that we learned in our 40s, how could we apply that earlier? Could that have helped us? Because you know, and I know when you do self-reflection, once you had that diagnosis, you're like, oh,
Yes.
it made so much sense
Yes.
about some of the struggles
That's right.
and some of the self-doubt.
And that's my experience with it for myself. I've had clients who, when I diagnosed them, that's the experience that they had. But there are also other clients that I was like, I think they have ADHD, but I could tell they were going to be more sensitive to that and higher functioning, but sensitive to the idea of it. And
Yes.
so for me as a clinician, I don't know if you find this, but I have to sort of kind of take my intuition and play with how are they going to feel about knowing this and still share it with them in a time that's timely, in a way that's gentle, right? Because for some of them, it is a very, and I don't know if it's a misnomer that's out there about it, but it's very scary for some people to have that label.
Sure. And I think we have a slightly different experience because of you being a therapist and I'm being a psychiatrist. So a lot of times I'm getting people coming in already thinking in the medical model.
That's
so
fair.
that you have to.
That's
you
a
have
good
that little
point.
more trickier because you're just seeing someone who may be coming in for certain, just like I'm just not feeling so well, not necessarily looking for a diagnosis.
That's right.
Oftentimes when they're seeing a doctor like myself, they are looking for a diagnosis or something or what is going on. But I like, I think what we're hinting at too, though, is that how does a person utilize a diagnosis? Is it useful or do they make it a label and like stick it on to their identity?
Yeah.
And I think that's where I often have a conversation if I believe I'm going to diagnose somebody and I got a bug.
Sorry, yeah. That's the great outdoors of Montecito.
That was perfect. There's actually a little bee. It was interesting.
Yeah.
So I guess he wanted to make a nest in my head. Or so anyway, and then of course that diverts me off my attention.
I know.
So
hello,
can ADHD or can you get me back on track?
Yes.
So with the labeling of the ADHD and how one would utilize it is that, in any of the psychiatric diagnoses that we have, they're not diseases. They're quote unquote disorders, which means that we see these cluster of symptoms and they have this sort of like, they kind of come together. And if you match a certain number, it usually means that we can provide these type of treatments. Now, it's also notable the work that our DSM-5.
Yes.
That's
like our Bible for like the disorders and how to kind of treat people.
Exactly.
Symptoms, right?
It's like the book you go to get all the like, all right, does this match this criteria to get that diagnosis? Well, it's interesting to note that most of the psychiatrists that write that novel are also funded by the pharmaceutical industry.
Yes.
So we have these perverse incentives.
Yeah.
And again, even with people who are conscientious and they think they're not going to be biased, unconsciously, we know psychology.
For sure.
If you're going to have money in that direction, you're going to have more of a leaning in that direction. So there's this tendency to pathologize a lot of things that may not be pathological.
Totally agree with you.
So because the way the mind works is there's always trade-offs. One area, it could be seen as a disorder or problem, but in another area, it leaves room for this other capacity that actually might be a superpower or a gift.
Right.
So that's really how you want to look at this.
And I don't know about you, but that's my experience with ADHD. I mean, I feel in some ways it feels like a gift. It certainly, there are areas like when I moved to Montecito, I lost my property check on the beach. I lost my keys. I lost my wallet because I was in transition and didn't have a system.
Oh yeah, that's the worst. Transitions are the worst.
They're awful. And so like I was out of my routine and I didn't have one yet. But so yes, but like for the most part, one of the things I've observed with a lot of people with high functioning ADHD, or even with people with ADHD that have really good systems in place and learned how to work it is like a genius gene. There's a spectrum of like, I see the creativity and the go-get-itness and it's like, I see it a lot in working with entrepreneurs, right? And so to hear people have like a struggle as a label, I'm always like, oh, wow, okay, I got to be mindful of that because that is not my relationship with ADHD and not what I often see in the population that I work with, which is a higher functioning, higher performing type of individual. So I think that's such an important piece of information.
Absolutely.
Yeah.
Yeah, no, there's no doubt. And I think that's why with each person, you want to see what it is. And actually, oftentimes I don't even have to give a diagnosis. I'll just say like, hey, you're having some problems with your attention, or you're having problems with your ability to regulate your emotions in certain ways. So we could just break it down and just talk about the actual areas of the brain where the person is having the issue with. Now, we could cluster it together and say, if you have this cluster, it's called ADHD. If you want to have that, if not, we can throw it away.
Right.
You know, whatever's worth, because I'm here for the patient.
Yeah.
And you know, we have to meet the person, as you know,
Yeah.
at where they're at.
Yep.
And sometimes, you know, we may have to hold off on something like that. But sometimes if we educate appropriately, I think most people won't see it as a stigma.
Yeah.
And I think things like this and us having this conversation, and people who have ADHD, we can destigmatize it and depathologize it.
Yeah.
You know, there are obviously, again, like autism, it's a spectrum.
Yeah, agreed, 100%.
And so you're going to have, and it's highly genetic too. So there is a lot of arguments going on in that ADHD has maybe potentially some evolutionary benefits that when we were hunter and gatherers, you know, the idea of being novelty seeking and wanting to be, and being distractible, but being able to be hyper vigilant, taking in, we're mostly very sensitive to the world. And so all the senses coming in. So when we were hunters and gatherers, perhaps people with ADHD type qualities, most people want the familiar. They want the same routine, you know, the thing, they don't want to venture out into the unknown. But when you're hunter gatherers, after the resources have been depleted, you have scarce, you need to have some people who are willing to go to the unknown territory, and they're moving their bodies a lot and doing all that stuff. Well, it makes sense that we would have a portion of the population that would have these characteristics. And so now, obviously, if it goes higher and higher to the extreme, it could become more pathological. But when we come back here, and off of it's matched, because it's not correlated with IQ, but if it's matched with a higher IQ, what happens is that most of us, and I'm sure you could relate to this, is that one of the big things with ADHD is that it's hard to focus on things you're not interested in.
1,000%.
Right? That's one of the biggest things, or whatever it was that you're being taught in school. And you're like, oh my God, and you know, it's hard to stay focused. But then some of us, you know, who have the capacity to kind of say, you know what, well, how can I trick myself into getting, you know, getting interested in this? And because you realize that's the magic sauce, and you can come up with ways that way. Like when I was in medical school, we were learning microbiology, and they're teaching you all these little proteins, that all the little bacteria and viruses, stuff that you know you're never going to use again unless you're a microbiologist. Like, you know, there's no need to have all that stuff. So I'm like, how the hell am I going to memorize all this stuff? Because brute force memorization, I had to understand it, but now you're given this really no other way but the brute force memorization. So my trick was like, I'm going to imagine that my father is about to die from some weird virus. And I just put myself in character.
Story.
And then, I've created a narrative. So then I can just get it. And I needed to learn microbiology better than anyone. So that got like my interest going. And I would do that and play like characters and do little tricks like that. And I think that's what some of us who we're more high functioning are able to kind of look at, like, all right, now we can take that interest issue that it's hard to kind of get over the hump into interest. You can learn tricks to get you into that. So that's
gamification, right?
Absolutely.
I mean, that's just like something that like I still do today, where I'm like, how can I make a game out of it? Like, I want to bet. What's the bet?
Exactly.
Like, if I will get through some of the most arduous, boring things, hanging wallpaper, though I've never actually done that myself. Now I'm going to win that bet. That just makes it more fun for me.
Absolutely.
Yeah, for sure.
I do things and I time myself. Can I do that in 5 minutes? Can I do this? Can I do this? They do that kind of well. It's like, all right. And that's why I love that. That's the way, like, if you're faced with a challenge, make it a game. Points and whatever, you know, however you want to do that, because there is some relationship. Again, some people, there's a lot of argumentation in regards to ADHD, because in itself, it's still kind of a gray area, exactly what does it totally encapsulate. But one of the things that we've seen, and I at least seen clinically, and that is that there's the idea, like, for instance, like extroverts need more social connection than an introvert does.
For sure.
Introverts still need it, but extroverts need more. So that's that kind of built into their temperament. And so with ADHD, one of the ideas sort of espoused by Jaak Panksepp was that the idea that we would actually need maybe more play. There's this basic primary emotion that all mammals have. We have 7 primary emotions, according to Jaak Panksepp's literature, and that one of them is play. We see like dogs playing with each other, cats, you know, playing with each other, all this kind of stuff. So we like to play. And you can imagine that there's a spectrum of need for play. And what we see with ADHD, and I actually see this, and I've actually used play, and that's why I think, even though it may not correlate with, like, one of the ways that some of the other doctors were saying was that maybe they were deprived the play, but I think it's actually a higher need of play. And if the culture is not built around that, if you have to sit still for 8 hours a day, you have to do all those kind of things when we're innately wanting to be moving our bodies, well, now you make that person sit still.
That's right.
And we call it hyperactivity.
Yeah, right.
Now, I'm not saying there's some hyperactivity that literally is a brain issue.
Sure.
But there are times when that hyperactivity, when we're talking about that spectrum cutoff, where that hyperactivity, if you exercised, if you did things that got your body moving and you played, you wouldn't feel it anymore.
Yeah. I love the point that just because, the high functioning piece of ADHD does not mean high IQ necessarily.
Yes.
But when you have those two things together, it can be sort of like really fun and off the charts, it sounds like. But take me back to what is it about people that may have a higher functioning ADHD versus people who don't? How does that happen, right? Is it from the seat I sit in, I would think of it more of like an adaptation, like a coping mechanism. But I know there are a myriad of ways that we can get ADHD. But for the higher functioning, how do you make sense of that?
I think there's different types of ADHD. It depends on who you talk to. Like, the DSM-5 just has the different, there's a inattentive type,
right,
and then the hyperactive, impulsivity dominant type, and then the combined type. But there are other people out there, like this guy Dan Amon has 7 different types, which I found it somewhat useful to use some of his kind of things, like the anxious type, the overfocus type. So there's these other kind of ways of breaking it down. And I also think it's a matter of degree. What we notice is that when people with ADHD, they're inattentive to a lot of things that are, obviously things that are boring, things that they can get easily bored, and they need new stimulation.
Yeah.
But there are certain things that when they're really interested in, they can video games,
all in.
Or it's just something that you just love a book. Like I know sometimes I'd read a book, like it was like the Call of the Wild. I remember I just started reading, I got absorbed and zoom, I'm done with the book by the end of the day. I spent the whole day just reading it.
For sure.
So I think what happens is that certain people might have fallen upon, where does it lead us astray? Where like, hey, one of the things is that we tend to have not so great short-term memories. Sometimes you'd be like, all right, I'm gonna go look for my keys, and you go to the next room, and then you're like,
what
am I here for? Right?
Don't even get me started on the computer.
Yeah.
Because the computer, right, you'll go in to do something in my email, but then I'll get like some sort of pop-up will come up or something, and I'll just go, wait, what? And I'll go down that rabbit hole. I mean, the computer is like where we need some systems in place.
Oh, absolutely. Phones, computers, notifications off.
Yeah.
Do not disturb mode, like on myself, because that will divert my attention. Again, there are different people, other people, they're okay getting interrupted in there, and they just like the constant new stimulus. Other people, like myself, if I'm on task and something comes in, it feels like it feels uncomfortable.
Really? Like in your body, it feels
like, it's like a ding. It's like I just got cattle prodded.
Oh,
a little
wow.
bit. Like noticing that, it's like when I know I need a certain task, I tell like my wife and everything, when I close this door and we make that pact, I'm just locked in for the next couple hours or so. The key is to learn what works for you and really make your environment work for that. Because I think ADHD, when you're faced with a challenge, usually I try to think about 3 buckets in a way to organize it. It's like maybe there's new knowledge you need to learn. Maybe there are some new skills you need to practice, because that obviously requires you to be a fool before the master, and you have to keep applying it until you get the skill. And then you have your resources, whether that's going to a therapist or getting a coach of some sort. But I think this is the key area that for ADHD, if you think about it, if we were the ones that were the novelty seeking, we're going to need that person that loves to get into nitty gritty details and all that kind of stuff. We're going to need that. So we have to be willing and not feel like there's a deficit in ourselves just because we're not good at that stuff, that we can actually find someone who's good at that stuff. And I think the high functioning people get that idea of delegation and or have the resources to delegate. That's also another area, and not feel like I have to be ashamed because I suck at this particular area.
So it's a little bit of grace for ourselves that it sounds like, that maybe even if someone doesn't know that they have high functioning ADHD, maybe some of the telltale signs might be something like where you are willing to delegate, but you maybe, what's the why behind the delegation, right? How else might someone who hasn't been diagnosed with high functioning ADHD, how else would we diagnose them with the possibility of having it? I know for me, some of that is time blindness, right? I can get so like, oh, I've got 15 minutes and I start this project, and then the next thing I know, I'm running late because I'm just super, ready to just go. And I used to consider that ambitious, and I might still say that it's ambition, but I also, it's like, I was part of the game. How much can I get done before I actually need to go? But then I got super involved. So little everyday things like that. I'd like to explore a little bit more of how else could someone recognize some of the signs that they are maybe higher functioning, but might have ADHD, and why should they care if they are higher functioning and they've been successful?
One of the things that most people could do is that if they had this sort of intuition starting to build up as we're talking about these different characters, and they're sort of reckoning, oh yeah, I get that, pay attention to that. I always tell my patients too, pay attention to when your body interjects. That's that or ooh. You're not controlling that. That's like a telltale that your body says yes. Pay attention to that, because that's really telling you something. And then I would just suggest, if you think so, just start writing down your pain points. What frustrates you?
Or your partner's pain points. Because my partner would be like, squirrel, because I'll start one conversation and the next, he's like, where did that just go?
Exactly.
Hello, come back.
What are the repeating patterns in your life that are a little annoying, frustrating, both for you and those around you?
That's right.
And I think that would get you, once you make that list, you can really see, and then you get in your confederates to see, does that agree? Yes.
Yeah.
Okay. I think that's actually the easiest way
that makes such great sense. So, I work with a lot of entrepreneurs or in that space, or becoming entrepreneurs, or people who have built companies and whatnot. And so both of us have a background in substance use disorder and working in treatment as well. So I actually started going down this rabbit hole for my doctorate, because I noticed in working with the treatment population, they started carrying very similar traits as people who are working as entrepreneurs and founders. And I started going, I started doing the research, like, what is the similarity? And I think a lot of what I'm seeing is certainly sort of that almost impulsivity, maybe not rush, more so higher risk taking, certainly higher novelty seeking, similarity.
All of that.
Yeah.
And in the literature, when we look at like the personality traits, extroversion, most people tend to lean towards extroversion. They tend to be less agreeable. So like,
with ADHD, you're saying that they have more extroversion? Is
correct.
That what you're saying? Okay.
Yes. There's a tendency towards extroversion. There's a tendency to greater openness. So thinking of new ideas, seeing different ways, because one of the interesting things about ADHD is that we tend to have a spidey sense. A lot of us have either heightened visual sense, auditory sense, smell sense. Actually, that's one of the reasons why we have trouble attending, is because we have that gates the attention. A lot of people can just block it, and it's easy. For a lot of us, in different ways, it could be sounds that drive us nuts. It could be the textures that drive us nuts. Like we have to cut tags in our, on our shirt. So everyone, it could be a little bit different, but like there's just this intensity of sensation that goes on, where we have to deal with how to focus in that. And that can be very, very tricky at times.
But what we were talking about too with that is just how a lot of people go into entrepreneurship or addiction and the similarities in that. But from my experience of working in both, quite frankly, it is a lot to do with sort of the novelty seeking, tolerance for risk. And it's like a lot of creativity.
Yeah. So like the extroversion, the willingness to go out there, the openness to new ideas, novelty seeking, and also they tend to thrive in chaos.
Yes.
Right. And so that unpredictable environment,
That's me.
like you go in there, and that unpredictable nature of starting a company is like, it's thrilling.
Yeah.
It's thrilling.
But why do you think it is that because I am like, when there is chaos, when shit hits the fan, I'm your girl. I'm going to hold it down. What do you think it is about ADHD that is about that thriving in chaos?
Yeah.
What is it?
Well, we do know that like, it takes a little bit more of that oomph. It's like in that chaos, is like you took the perfect stimulant, right? You just took the perfect stimulant, and your brain's now in that hyper mode, and your whole attention bandwidth is on one thing. I remember I was emergency room tech, and I had anxiety, like a decent amount of anxiety. However, when we would get trauma ones, and they would call me because I was the big guy, I had to be the one when they helicoptered people in there to get on top and do the chest compressions on there. Like, it's very nerve wracking. And then you had to do get a blood pressure. Sometimes you had to do it like reading with all this other stuff on. But in that moment,
you can hyperfocus.
It was easy. I had no anxiety at all. One of the trickier parts too, though, is the idea of like giving you your own natural stimulant, which is through stress, like stressing, like using anxiety as a driver to get you off your ass, to do the procrastinating thing that you've been pushing off. Yes. Now, whatever is the dominant emotion that makes you do something or decide something, you doing that action or making that decision reinforces that emotion to come more frequently in your life. So If you make anxiety your thing to drive you, just know you're making sure, guaranteed that the anxiety is getting stronger.
So it's you're wiring it mentality.
So that's why I try to get people to look for their pulls. Like, what is it that pulls you forward, inspires you, curiosity, love, those kind of things. And starting to get away from the conditioning, because we all kind of used it as kids, was to get us to get that project done, using that stress to do so. And what we're just trying to find something what is it that you value? Link it with that to the motion instead, so that you're not reinforcing anxiety in your body, because then you'll always be dissatisfied.
Yes.
And that's what I see a lot with the really highly successful ADHD people who are entrepreneurs, is that oftentimes they sell that business. They were sold that that's going to be like the end all be all, and I can go out and get a margarita and sit on a beach and do that kind of stuff. That may work for a couple months.
They hate it.
And then after a while, it's like, you're going to get bored. Of course. You're novelty seeking. This is boring.
Yes.
You know, I don't care how many people you sleep with or whatever it is, how successful you are, it's going to get boring.
Yes. Well,
I hope it gets boring, actually.
Yeah. Yeah. I mean, you know, I do marriage therapy, right? So I also see that it can play out that way as well. If you've been married for a really long time, if you're with someone who has higher novelty seeking, right? That's one piece of the puzzle, but it's not the whole puzzle. But hey, pay attention to that.
Absolutely. That's where the understanding can make it so that way we don't have to personalize it. If the other partner understands that the reason why that person wasn't really paying attention to everything wasn't because they weren't really caring about it. That ability to attend like that is not under their control.
It's a checking out
It's
system.
not a willpower. Like you're just mental blinking. It's like you're tuning in. It's something I'm interested in. So I'm tuning in on, I wonder what I'm going to have for lunch, today. All right. And then I come back in. One way I think Andrew Huberman was describing it is like, we're in default mode when we're just sort of daydreaming. Yeah. And we're just sort of having our mind. We're not in any goal. But for ADHD, this lever to go all the way into task mode actually gets stuck middle way if we're not totally engaged and totally loving it. And that halfway point, you're getting flooded by, still other thoughts. If you're on task and then all of a sudden you see something along there and then another thought grabs you. And if one of them is enticing, all of a sudden you're grabbing that thought and you're off. Yeah. And that's the problem. And the other issue where people can have struggle with is that they can get locked in and lose their flexibility to switch tasks. That's how people get caught up in burnout. ADHD and burnout, they can just keep riding the midnight oil, not paying attention to their body, not feeding it correctly, all that stuff just unravels. There's a level of coming back to routines. Routines are extraordinary. You can't be high level for long and high functioning and not have it break you down. Complexity is just going to continue to go up, not down. And you have to be able to create habits. Yes. And drill those habits. Good habits. It's like practice.
Because you can also create bad habits.
Absolutely.
So create good habits. Okay,
absolutely. And really learning how to delay that instant gratification tendency that we like to go to. And then, so you have to be very careful. And that's where I think essential is things like sleep, nutrition, these kind of things, especially the gut. That's one area that's super important there. We have to get their sleep put together. Yeah. That will also incorporate, when we're doing that, a morning and a nighttime ritual. And so that also teaches people how to build new habits, because a lot of people don't know how to do that correctly, because we tend to be our own worst critic and we won't give ourselves any leeway, because a lot of ADHD suffer from all or nothing syndrome. Sure. It's all or nothing. Either I do it like super well or fuck it, I'm done. It's like, I'm
going to put energy toward it. Let's just get it done.
I have 2 gears all the way, and then that's it. And so I tell my patient, we're going to have to build, you have gears 1 and 5, and we need to build 2, 3, and 4. Love it. Because there's no way you're going to have longevity in what you're doing if you continue to do what you're doing right now.
Yeah, I mean, it's a similar experience for me. Definitely not emergency room level, but just working in the entertainment industry, like I would love working on like the events like Kids' Choice Awards when I worked for Nickelodeon, because first of all, it was like a 4-month-long project versus like something that was just routine, ongoing, evergreen. It was just a start and an end. Yes. And that was a huge appeal to me.
Of course.
For having high functioning ADHD. you had to manage so many things. It required me to be able to keep a high level sort of purview over everything up here, because being in the weeds is very like, ugh.
Yes.
Like, ugh, right? So it's like being up here and being able to manage all these different things. And so now being a clinician, one of the ways that my ADHD plays out for me really well is watching all the things. I don't know if you experience this, watching all the little elements happening, whether in the room or by Zoom, of like facial expressions and what's being stated and what did he say while she's saying this. And I'm sure my partner hates that I can notice all those details. But I'm a great clinician for those reasons, right? And I think that's one of the ways that ADHD has really been a kind of a gift for me, is being able to see it from this high level and notice all those nuances at the same time.
Of course.
And it's kind of like being a part of chaos, right?
Yeah.
And holding it down.
Well, it's also your ability to you're taking multiple streams of information simultaneously.
Yes.
So you're able to do that, and then you can, it's called consilience, by just one stream, but now you can put 4 streams together, a kind of pattern emerges.
Yes.
And you can feel it, and then you can go like, and I often get it in the sense of like images. Like I get these powerful images, like there's this capacity for getting the gestalt on things, that intuitiveness. That also could relate though as well, because one of the comorbidities that come along with being ADHD, because we tend to be loud. We tend to be noticeable.
Charming.
Yes, charming. But we can often get, some trauma. Like what parental trauma, like getting hit or something like that, because we're loud. We generally get overly exuberant about things. Get totally all like, oh my God, and we gotta be restrained back. But so then oftentimes we do see this relationship with like having experienced a trauma in that back, so which can lead to when we have this enhanced sensitivity, which is our gift, but then it becomes hypersensitive.
Yeah.
So that's why when I talk to my patients, like, right now, when they oftentimes are burnt out, like a lot of times, we're talking about our entrepreneur friends there who were super awesome in one area, but they were totally ignoring a lot of other areas. And a lot of times it's their body, and a lot of times it's their relationships.
Yep.
And so, but they're doing really, really, really well here, but then they have to like come back in, and we have to kind of like be able to take a step back, take a breath, and start to kind of like see like what is going on here, so that we can start to rebalance. We can make that gift work and not let it burn us out.
Right.
That's the trick. And it's an ongoing process.
You were also mentioning the importance of like systems, right? So let's talk a little bit about some of the systems. A lot of people, especially high functioning, don't need medication. I do believe there are some people who really, I've seen it where I've really encouraged some clients to like consider it, get on it.
And there's different types of medications that you can use that are not necessarily the classical stimulants that can be extremely helpful as well. Because a lot of times, if let's say there is more of a trauma history, it could be that there's a lot of somatic anxiety and cognitive anxiety that's just overwhelming the attentional bandwidth. And that way, by actually not giving a stimulant in that situation, probably makes it worse. But we can give things like guanfacine or clonidine that may calm down that. The adrenaline might be a little bit too high, or you're just too sensitive to it. So we can use that as a tool. There are other ways to also boost dopamine that might be there that are in the natural sphere. There's a lot of supplements that I might use. We like to do a lot of blood testing, because that's where the nutritional part plays a large role. Like when I'm working with somebody initially, the first thing is sleep, absolutely essential, and then nutrition is absolutely essential. Then what I like to do, if we can work on that and we can get progress, but we may need to, oftentimes if it's a disaster area though, we may need to use the medication first of all initially, because sometimes it's hard for them to even make the habits first. So you may need to use the medication as a tool to make the habits.
Or I call it a bridge sometimes.
Exactly. And then once you have the habits, then you can start to back off using the tool. Because the habits are now your gift, and you have that.
But a lot of the people that we're talking to, they have trainers, they're nutritionists, like, but still I noticed even within myself and with some of my clients, like because we become super hyper-focused in our work, let's just say, I'll just like say, oh crap, I haven't eaten yet. And I just do the impulsive grab, right? So the preparation. And also I'm just curious, because you have a master's in herbal medicine, right?
Yes.
Like, are there certain herbal medicines that are better for people with ADHD that they should be incorporating into their diet?
Diet-wise, I mean, there's a lot of things that could be done to the diet aspect, but for herbal things that go on, it depends on the person. Again, it's like it can be a little bit of trial and error, but I actually like a couple supplements that I like with a lot of my ADHD patients are ginkgo biloba, but it has to be a certain kind. It can give a little bit of a headache because it actually dilates the blood vessels, makes them, in the brain, and if it hits next to a pain receptor, you can feel it for a little bit.
But then why would I want to take it? Like, how would it be helping me?
It tends to actually improve alertness. It's really about balancing your autonomic state, your fight or flight, with the rest and digest, and really trying to find a balance between there. So you might be overly stimulated, right? And that's where a lot of patients who I inherit who were taking medication, they usually are taking too much medication.
Yeah.
People are taking Adderall a lot of times. If you're taking more that's actually artificially going much higher than your normal dopamine rate, you actually become dumber. You don't actually, your working memory suffers when that happens. But if you take the right dose, and that is usually what you should barely feel it, barely. I don't want it to take away all your symptoms. I want you to take away maybe like 50% and then use it to make the tools to build the habits that we can go through. Because otherwise, if it were to help 100%, the person would be less motivated to want to do the work.
Right. So you need the drive, which is you need the dopamine.
Some people might need a little bit of stimulant up front. Other people, we can work on the diet or just work on the sleep. It'll get better, and then we can use supplemental tools if they need a boost in dopamine, or if they need their serotonin, if they're a little more anxious based. Iron is important in dopamine production and just energy production, and so oftentimes I'll see that. A lot of times that happens with a lot of my ADHD patients who tend to be on the vegan or vegetarian side. So we'll have to kind of work with that. Because I believe, a lot of us who are in the higher functioning, if it wasn't from some sort of pathology that led to some of the problems with the inattentiveness, that we probably were, there's probably some credence to this evolutionary principle that we were hunter-gatherers. And I see that us ADHDers tend to, not all of us, tend to do better on a kind of paleo style-ish diet. Going back to pre-agricultural, where we're, not eating like bread, not eating, like refined sugars, that kind of stuff. We are more sensitive. So we're definitely more sensitive. That's why we see these dietary studies, like one showed up to 70% reduction in kids when they took out a lot of like corn syrups and the preservatives and all the little different things, unrefined sugar. We do see this huge gut brain kind of thing, and particularly with ADHD.
It's awesome to hear, because I think that is especially important for people who are trying to figure out, like, do I have this, right? Because a lot of people, as we talked about in the beginning, like, I had to become a clinician, see it in my other clients, and start recognizing it within myself. So I think nutrition and how you eat could be one of the ways. When you eat, how do you do it? Like I said, I would grab sometimes because I'd get so hyper. So learning what are the signs, and I think we've talked about it before as well, like, what are your partners complaining about? And taking note of those things, because what we're really talking about is if you have high functioning ADHD and you've been successful, you've created these, cool adaptations to still be successful, systems, delegation. What we're really talking about is self-mastery. So when you're talking about breaking it down, like in the morning, what is your routine and how can you optimize better? That's why if you've already been successful without even knowing that you have ADHD, it's like the self-mastery piece for optimizing even further.
Oh, absolutely.
Right?
Yeah, because then you can see where are my problem points, and it gives you a frame from which to look at. Okay, I can see if I have a short-term memory issue and I tend to forget, but if I make this system for this thing that I tend to do often and I just sort of do it in a way, the area that we have some issue with is called the frontal lobes. The way that's the thing that tells most of us to not say blurt out the thing, or when we're
blurt out anyway.
Yes, that you're blurred out anyway. The filters, all that kind of stuff. We have a little porous filtration system that can go on there. So what we need to do is by training in these behaviors, it brings it to a deeper part of the brain called the basal ganglia, which doesn't need to be conscious, and that's where habits lie. You've delegated that task, that boring task, now you don't have to use any energy. We call it cognitively offloading.
Yes.
And then you don't have to constantly make this decision, because if you don't set yourself up, I love to set myself up. I have a routine in the morning. I put my clothes out and all that kind of thing. You want to kind of, like, I call it lubricate your day.
Everybody, lubricate your day.
Exactly. And that's the thing, is you want to put the element of play.
Yeah.
You know, that way it just makes it so when we get frustrated and everything like that, we can start to laugh at ourselves.
Yes.
Such a better way than when we're really out of balance. Because I'm sure we've all had periods of really deep imbalance, and it's like, it's really painful.
Yeah.
And that's another thing of learning is that, like, yeah, it's okay. And then you can reach out and find, you know, other ADHD people to hang out with, because they generally, I notice we tend to hang out better because we kind of get each other.
Yeah.
You know, we get that we're going to say wacky shit together and stuff like that. And we like it. And you know, we're not going to be politically correct. And not, we just, you know, our inner voice often becomes our outer voice, right?
And I want to color outside of the lines.
Exactly.
Don't drive with me, but also don't make me color inside of the lines. That's for sure.
And don't give me an interesting story while I'm driving.
Totally. Wait, where are we going? Wait, I'm in charge?
That would be terrible.
Yeah, it's so fun. Again, I'm going to go back to, like, for me, I've had a lot of fun with it, but I think it's because I have found ways to cope with it. But I also believe that I could have been further along a lot sooner in life had I known what I was looking at. I wouldn't have struggled so much with the food, the way I was eating, right? And then self-esteem that comes along with it when you're, you know, especially when I was working in Hollywood. There's so many things that could have just been a little bit better.
Sure.
And if you just know yourself better and you just know, hey, there are roadmaps, right? Like the systems that we're talking about and just the way to eat, all these things can guide us to, again, it's really about self-mastery at this point.
Yeah. A lot of us have very harsh inner critics inside of our brain. And it's like, you're like Sisyphus. You just keep going up and you're just being whipped and you're being whipped and being whipped and being whipped. And that can lead to a very uncomfortable life for a lot of people. And I can see how driven some people are, and they're just so driven, but they've kind of lost the sense of purpose at that point. You know what I mean? It was like maybe to make, you know, money to, you know,
sell your business.
Yes.
Right.
Exactly. And just to be that way, and then I can relax.
Right.
Sure.
They sell it. They think that they want to live there. And then what happens?
They feel this sense of deep aloneness that then turns into loneliness. Up to 50% can experience deep loneliness at any particular time, because we tend to be different. We're neurodivergent. We think differently. I have another patient who is older, you know, in their 80s, and their ADHD, and it's like, although they have a lot of friends and everything like that, they struggle because they like to tell off-color jokes, and they have to kind of keep it to themselves a little bit. So, you know, it's easy for us to feel alone. So that's why when that aloneness, when that entrepreneur who just sold everything, and then they didn't realize that it's like there's an attachment to the business itself that you sold.
1,000%.
How much time and hours that you did it is a baby. So you got that whole experience, and so then people can really devolve really powerfully. And you talk about, like, well, midlife crisis happens often at that time. You're not now as energetic and as facile with your mind and everything as you used to be, and you start to doubt yourself. And we're working with patients like that. That's like a prime area where a lot of people who, it's like getting the rug pulled right underneath you. Like, you were sold this bill of goods that this is the happiness. I've done everything that you could do that I thought was going to make me happy, and now I'm miserable.
It's sad. It's really sad. So it's, again, it's about self-mastery, learning, and then finding something else to get excited about. You know, it doesn't have to be starting a business. Again, at 50, it can be investing. It can be doing something that brings you other ways of joy, mentorship, things of that nature, right? But it's finding something that's going to keep you going, because you can't just, like, cut that off at the pass.
Exactly. I think one of the things is that I like to do is, because we can be very externally focused, and I try to then balance that out by teaching, and it's actually a really good tool to improve your focus. I teach my clients how to sense their body. Pay attention to it more, because we can get caught up in making these sort of, like, if you get caught up in making the habits too, you can start getting into what I call too much rule-governed behavior. All right, this is what I do on Monday, this is what I do on Tuesday, this is why I wear my Aura ring, and I do this, and it gets so rigid that you're not listening to your body, and that's what you can burn yourself out again. So we need to learn to respect this. We need to learn to, like, if we want to have longevity and a high quality life, you need to respect the vehicle that you're in. So that's where I come back, and by just directing your attention to your body. So what I recommend with ADHD people when they do in these sort of attentional exercises is that they exercise first, and then do the attentional training second.
Got it.
Because they usually could be a
Love
little
that.
restless to do it initially. So,
So
a
we're
little
like
bit of
wearing ourselves out first.
a little bit.
Yeah,
Just a little bit. Not so much that you get sleepy,
Sure.
but just enough to kind of get some of the energy
Sure.
out, and then do the focus, because then you get your dopamine up. They found, you know, that if you just do this sort of interoceptively, sensing your lungs and your breathing, and then sensing behind your eye, third eye, any kind of interoceptive practice, it could just be on your breath. You could do what's called body scanning, and there's many things on the internet where you just go from your head down to your toes and just sensing each body part. You're just sensing the inner part. Also, how to learn to pivot your attention off of your verbal, because most of us are hyperverbal.
Yes.
Constant chatter on here.
Yep.
So is not to try to stop that. That's, you will not win that game ever. I don't care how much mastery you develop. You just let the verbal go and then redirect your attention to the body. That's what you do. You're pivoting, and that will help you be able to better attune your focus on areas that you may not be as interested in, but if you can get it, and then you can start to use other techniques to try to make you self-interested, like some of the other tricks.
That we talked about,
You can gamify all that other stuff. You could spread your attention, and now you're gaining a higher level of balance and functionality.
I think it's really important that we talk about, you know, like you said, like there's some co-occurring disorders like anxiety. You've seen it with like OCD, OCPD. Like, talk to me a little bit about what you see in your practice, because I absolutely see it playing out in all the ways.
Sure. The anxiety is a big one. That woman, if the anxiety is strong, they'll be less likely to be entrepreneurs on that type.
You got to be able to handle some risk.
Correct. On that spectrum, though, I see a lot of people, though, with trauma who then have used that trauma as a driving force.
Sure.
Where that I see a lot of, like, you know, like people who've gotten bullied, people who've gotten, you know, other types of kind of trauma during their life, and then I'll show you.
Yes.
Mentality.
I might know a little something about that, Mr. Mantz. Yes.
If that powers it all the way through and it doesn't change to something else over time, that's going to lead to burnout.
Yeah.
Because it's running, again, it's the idea of what drives your actions. What's the principal thing that's driving your action? You know, again, there's always multiple emotions, but the dominant one, if the both dominant ones to gain revenge and say, hey,
for someone with ADHD, that's about a win in a game again.
Yep. Because if you haven't gotten to the point where that is no longer the issue, that they show the person up, you're still living in a regressive nature.
Yeah.
You're still not yet fulfilled the wound of the insecurity that was grown during that period in your childhood.
Yeah.
And so that's where oftentimes too, a lot of deep inner work is needed.
Yeah.
You know, for those of us who, you know, who obviously we were noticeable. So then we often got yelled at. We often got spanked because we were the obvious ones.
Well, we were the obvious ones. We felt it. We became the scapegoats.
Correct.
Right? Because we called it out, because we blurted it out, because we noticed it. We talked about it, and you're not supposed to talk about it. You may not have talked about it in the most diplomatic way, but like you just like, this isn't right. I remember saying that even in corporate America, and I was like, this is like bullshit. Oh, I didn't know you were supposed to say that. But like, apparently you're not supposed to say that in corporate America, which is why I make a much better entrepreneur. So we talked about anxiety. What about, like, what do you notice about OCD or OCPD? And also, I want to just acknowledge my experience with a lot of clients when I try to talk to them about trauma, they assume big trauma, like rape, war, and they don't want to often look at what sometimes we call little T's of like child neglect, like emotional neglect, right? Not even like physical abuse, just sort of like the invalidation, the dismissiveness that maybe they got well-intended parents, or, you know, the parent that, you know, just said, essentially making them want to earn their love, you know, applauding all the accomplishments, not applauding the failures for trying, the skill that they're learning and that they tried. So I think I just want to distill that a little bit too for the audience about what could also constitute a trauma and how that plays in.
Sure.
How does it work with like OCD, OCPD, and high functioning ADHD? What do you notice?
Yeah, so let's tackle the trauma question, because that's a tricky one. It can get so loose-lipped where everyone's, this happened and it was traumatic and this is traumatic, and that drives me a little bit nutsy.
Yeah.
That said, with ADHD, again, we tend to feel everything more powerfully, and we don't have as much of a gating capacity. We can get overwhelmed easily.
Yeah.
Where certain sensitivities can be like really jarring to the system. And so that can, lend itself to a vulnerability to like, one of the things that the brain is doing when there's a very intense stimuli. When we're young, we're just super sensitive.
Right.
And then you hear like, parents yelling and screaming, and your body's like getting jarred, and it might want to compartmentalize and dissociate.
Yep.
Especially those of us who are high functioning or may high IQ, we dissociate into our imagination. And we daydream.
Yep. Which also probably supports us being more creative, right? As we get older.
It could be.
Becomes
for sure
a potential possibility of like, hey, that was a gift in that moment.
For sure. Depending upon what the imagination was on, like, because you're this active imagination, and it might be really those of us with highly visual spatial skills can really get, caught up. And then whatever you give your attention to, it grows.
That's right.
Right. And that skill is going to grow too. And like you said, in some ways, dissociation can be somewhat, potentially beneficial at times. And actually is. Your body is protecting you there. However, you're conditioning the person to check out, tune in, tune out, tune in, tune out, and it becomes automatic.
Yeah.
And it's not something of willpower. And that's where a lot of people feel like, oh, if I could only attend harder. And sometimes actually there's a lot of ADHD where you try to do that efforting, and that actually makes it much worse.
But also I see it play out with marriage therapy too. So to be the partner of someone who's checking out, tuning out.
Correct.
And they're trying to, like, where'd you just go? I need you to be present, right? It becomes a problem.
And they could even be trying to be present, and that actually makes it worse.
Yeah.
Yeah, and that's the fault. And it's like, but so that's where the knowledge, we can depersonalize it, and we can just see this is a human thing,
right,
rather than a me and you thing.
Right. Yeah, that's so well stated. Yeah. I think the only thing that would be helpful would be some of the other systems that we were talking about, like the morning routine, night routine. I know you've got a really fun one for like your stuff. Is it like the Fab Four or something like that? You've made up some really good systems for your own self-mastery, which, by the way, like one of my favorite things and why I really only refer to Dr. Mantz when it comes to sharing clients is because I've just observed myself, your self-mastery, and admire how much awareness you have to yourself. And I know you take that same level of attunement and attention to your clients. And that's really the only psychiatrist in nearly 15 years. I believe in you and what my client is going to get. And then it's not just med management.
Yeah, well, thanks. I appreciate that. I think a lot of times I say to my patients, I'm not any better than you. I just had the problems earlier than you. So, a lot of times I went through a lot of this stuff with the ADHD and navigate that through. And then I realized how important habits were and how important sleep is. It's absolutely essential because it's hard for us ADHDers to shut this thing off.
Yeah.
Right? You can't. You have to actually experiment. You need to learn what are the things, how to not go and use your phone in bed. I had to make a rule, no phone in my bedroom. All I do is if I'm going to listen to something like audio, I always tell my patients, about 1 to 2 hours. It depends on your brain. You may need more than that. You need less than that. But 1 to 2 hours, you switch from video to audio. 40% of your brain energy is used to visual processing when your eyes are open and look. And then if you're looking at artificial stimuli like screens, which we were never meant to do, the retinas are the only external part of your brain outside of your skull. And so that's literally brain tissue that's being stimulated directly by artificial stimulation. And then we wonder why it's hard to shut off that inner commentator when we go into bed. So that's key. And once I started doing that, making sure that I'm not eating late at night junk light, that's super helpful.
Light.
Yeah. So that was helpful. And then being able to master my own sleep, because I had chronic insomnia for a long time, just hard to fall asleep. It would normally take me at least an hour or so to fall asleep, to wind down my brain until I was totally exhausted. Now, being able to work in how important it is to start your day. So I like to call it bookending your day. You have your morning routine, your nighttime routine. And, everybody can decide what that is, but the general idea is how to gently bring your body to increase its alertness, and how to then take that alertness and bring it down. I like James Clear's book on Atomic Habits. The first part of that book is just solid, and I like the idea of the 2-minute rule, that it actually is the number of reps that takes of what you do for a thing that sears it in, to makes it a habit quicker, and try not to miss twice. And that way you're not berating yourself yourself and losing your energy, your power to the self-judge. And I think that's another big one where therapy plays a role with the trauma part, especially for my men clients, learning how to grieve.
Yes, I couldn't agree more. Women often, even though a lot of women, don't know their feelings, women are often given a pass and allowed and expected almost to grieve and to cry and however that all shapes out. But talk to me about your own experience in holding grief and how you came to, deal with that with ADHD.
Yeah. So we're relating it to the tendency because we tend to be obvious that we're more likely to potentially get traumatized, get yelled at, hit,
Because
whatever.
we're more sensitive.
Exactly. And then we're very sensitive, so we feel that kind of stuff. And so, being 6'4" by the time I was in 9th grade, playing football, that kind of thing, you're kind of trained in a certain way, don't be a wuss, and don't cry, like ignore your body, ignore your feelings.
Shut it down.
And just push. We can get locked in and we just overly focus. And we can kind of run on that energy, like, because it creates a kind of a restlessness that some people can then channel with their sort of energetic quality and their openness, and it drives their business. And they can run on that for a while, but then ultimately that's going to be problematic. And oftentimes they have a very harsh inner critic.
Yes.
And that's what we were coming back around to, because that's telling you there's deep wounds. It's an echo of the past that hasn't yet been healed. And so by working through your grief, because oftentimes what it is, there's anger, and then there's grief in the core. And the anger is like, fuck you. But you have to be willing to, like, sometimes that has to come out in its own expression, and then being able to then open up, because a lot of times they weren't safe and secure. They are sensitive, and that's why they don't want to have that vulnerability. But if they can actually be, in such a gift when you see this person who's never actually grieved before, all of a sudden opens up and starts grieving.
It's scary because if they have never learned how, and now they've got compounded grief from how many decades?
That's scary for them, but that's where the idea is, like, you got to make it natural. It's natural.
That's right.
And what I generally do is because I deal with a lot of very cerebral patients, that's what we're talking about here, is I will explain it to them beforehand. Sometimes it's helpful to give them a little bit of a conceptual map, which then kind of eases their body a little bit. Because without the map, it's kind of like, their mind will jump in to try to control, and that's like trying to force yourself to sleep.
And I just want to kind of just reiterate, like, some of the trauma that you're talking about isn't necessarily like some of the stuff that people often just assume is trauma. Like, a lot of times people want to poo-poo what we would consider trauma, right? The child neglect, just not enough attention given to the kid because, well-intended parents, but mom had multiple children, or maybe couldn't attend to them for some reason, or dad couldn't attend to them for some reason, or dad was traveling all the time trying to pay the bills, or dismissiveness and validation. I see that a lot. And it's like this lack of attunement to the emotion that you're talking about. And so that is, I think, often unrecognized trauma by especially sort of that higher performing, higher functioning individual, because they go to that safe space of the brain, right? To sort of self-protect. That's the way that they knew that they would be safe, and then it just continues to be the safe way.
Why not? But then you're checking out.
That's right.
And it comes at a huge cost.
Including a marriage sometimes. If you check out too much, your partner does not want you checking out.
For sure. And you're not doing it on purpose. That's the sad part of it.
No,
it's actually just part of the conditioning that you're going through, and then it just causes more problems. So that's why it's really important when couples, that's where your area is like where you're focusing on how the dynamics of ADHD, sort of play out in that total area. The gift is that when I see my ADHD clients start to cry, the first thing is the inner critic will say, that was nothing. They try to discount it, but that's okay. Because when they've actually done the real thing, meaning that they let go, finally they let go. And the rain clouds came in. And see, grief is different than crying. There's differences between the two. Crying is like, I get overwhelmed and I'm just it's like a neck up phenomena. But when grief happens, it's from the belly, it's coming up, it's out and over.
Really great distinction. Thank you for
over
that.
and it comes in waves. You have this one, well up, and then boom, 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 boom. Then there might be a pause. Then there might be a second wave. Maybe, maybe not. But if there's a lot, there might be a second wave. There might be a third wave. And it depends on how tight the body is gripping to defend itself, because it can come out of retch. It's kind of like these conditioning, you often feel a tightness in the chest. Because a lot of times people will say, you know, I'm angry, and I'm like, but I feel this tightness in my chest. Well, anger is an outward.
Sure.
This tightness is anxiety.
Yeah.
That you're getting anxiety to that. So it's a wall. It's like it's this guarding that, you know, you're building your armor. It's your psychological armor that's saying, nope. But the problem is that cuts you off. You're cut off, and you're going to feel disconnected. And when that happens,
people are going to feel disconnected around you.
Exactly.
Yeah.
And when you feel disconnected, your opiate system goes down, and you become hypersensitive, because opiates make you feel pain relief, right? So if you get less opiate like tone, you're going to feel more sensitive. Everything's going to feel irritating. Get on your nerve. Why is that person chewing like that? What the hell? What do they keep saying that for? What does that sound? What is that sound? So that kind of stuff. Yeah. So we can see how then too, when you know you have ADHD, when you get more inflamed, then you know you need to like tighten the belt a little bit in terms of your routines, your disciplines. So I call this dynamic dosing.
Okay.
You know, you dial in, dial out. Like, you know, when you're in sleep, you know, do we have to have perfect sleep all the time? No. You know, you can get away with by doing some basic stuff, and then once you get the habit down, you can loosen the reins a little bit. But then all of a sudden, you may have some extra stressors come in. Someone you love got hurt. Something else is happening over there. Well, now it's time to tighten the belt again. You got to like reestablish. And so that's a kind of breathing pattern. You know, I gotta discipline it up. And then if things get a little bit easier, I can loosen it up a little bit. But you have to always listen to your body. That's your ultimate guide. Our minds will bullshit us. Our bodies never do.
Yeah, for sure.
So you just got to get good at reading your body
and paying attention to it.
Yes.
Yeah, for sure. So listen, a couple of things is because of my ADHD, I can hear the dogs going off, and so I want to recognize that and honor that.
Who let the dogs out?
Exactly. At what time, Montecito? Okay, so how do we find you? I know you've got some continuing courses coming out that you're going to be releasing next year sometime, but it's Santa Barbara Psychiatry.
Yeah, we're actually in transition. We're making a new website right now.
Okay.
I have my Miro set up and a mind map and all that kind of stuff. I am on Twitter. You can follow me on there. I'm Mantz MD on Twitter.
Mantz MD.
Yeah, and my Dr. Mantz website, again, we're in construction right now, is to teach people that the mind and the body, how powerful when they work together, both using your nutrition, your lifestyle, and all of that, something that you could really, really change and transform your life. And I'm really happy about your podcast here and showing how we can take the adversities that we face and what we think is pathologies actually can be gifts and give us the greatest meaning that we ever have, because that's what we're finding here. And it's been a blessing to actually be the first guest.
But it's also been a blessing because for me, I think that's why I felt so connected to you so immediately when you validated that I had ADHD after I diagnosed myself 8 years earlier. And then recognized that we shared a similar worldview around it, that it's kind of made us more fun and playful. And it made me want to make better friends with you. So here we are. So I do find like that was like a gift even just for us.
Yeah, well, we're in the same tribe.
We're the tribe, man. Join the tribe. Don't be afraid of the tribe, people. Anyway, thank you.
So
it's
much.
late. I really appreciate it, Michael.
Yeah, that was wonderful.
Thank you.